Well, so we're coming to discuss on this very holiday morning the issue of childhood cancers and whether early detection is crucial to treatment and whether in Ghana we're able to treat the cases at all. We're being told that in excess of 1,000 cases are expected to be recorded countrywide. That is intra. Now, what do we do about the current situation? We have in the studio Dr. Charlene Kilban, a pediatrician with the Korle Bu Teaching Hospital. A very good morning to you. Thanks for joining us for this morning. And Dr. Felix Kwame is the president for Ghana Parents Association for Childhood Cancers. A very good morning to you. How critical is the subject of childhood cancers? I have to ask you first, because you're the chief medical person on this very subject here.
Well, it's very important, and it's becoming even more important as we try to control the other things that have plagued us in the past: diarrhea, malaria, more of the infectious diseases. And as we get a control over that, we're beginning to see a new group of diseases that are emerging, the non-infectious ones. And for us, in child health, cancer is one of the major ones.
Okay, the beginning subject of discussion will be what is causing this rise in these type of cases we're seeing now among children, because usually, well, cancers would say should be affecting a lot more adults than children.
Well, that's what people think. A lot of people think that cancer is just a disease of adults, but children actually do get cancer, and we think that a lot of it goes undiagnosed, because if you looked at incidence worldwide, like you said, we should be expecting about 1,000 a year. We have only 2 centers that treat cancer in Ghana for children, and it's Komfo Anokye Teaching Hospital and Korle Bu Teaching Hospital. And Korle Bu is relatively bigger. But we see, roughly from what we're seeing this year, about 200 a year. And the incidence is rising each year. We're seeing more children each year. And we think that it's because, one of the things could be because we are diagnosing them better now. Maybe it was there but was not diagnosed. The children died undiagnosed, and we still believe that a lot more are dying before they are even diagnosed.
And for you, the association, what is, you get educated, or you do the education, or you pull resources together, or you pull parents of those affected together?
We do all those, I mean, all what you just mentioned. But on top of all that is the advocacy role which we're trying to play. So we want to sensitize the public about this disease and the fact that it is curable, it is treatable. So most people think that when you are diagnosed with cancer, it means that it's the end. No. So we are going out there to educate the public that if your child is diagnosed with cancer, that is not the end of the world. And that's with some amount of care and treatment. I mean, your child could get over it.
In a developing country like ours, we know that cancer is expensive to treat.
Yes.
Well, if it is expensive to treat, it means that treatment is unaffordable.
You see, it is very expensive, yes, for some cancers. Right. For some you just need a few hundreds here and there, you know, to finish it off. But in our particular instance, the difficulty is even compounded by the fact that our National Health Insurance Scheme does not cater for any of the medications. So it makes it very, very, very difficult. And most parents abandon treatment, you know, halfway. Some even don't want to come at all because of various reasons. It could be stigmatization. It could be simply the fact that we are told that when your child has cancer, you spend all your fortune. And therefore, why do I need to even...
Plus, you can just wait for some few years and reproduce another one.
Possibly.
No, not so much. I think the thing is that we attribute a lot of things in our society to spiritual forces. And so most people end up presenting very late. They would have been to the herbalist, to the fetish, to the pastors, and then come to the hospital as a last resort. So we see a lot of our children at literally terminal stages, which makes it very difficult to achieve any good outcomes. In developed countries where most of these are picked up earlier, in childhood cancers, they have a good cure rate, about 75–80%. Of course, each is different, and so the outcome for specific types of cancer differ, but on the average, about 75–80% cure rate. But for us, ours is as low as 20% because most of our children get to us too late for cure.
Now, the treatment centers, if you're saying we have only 2, that even presupposes that the specialists who should be handling these cancerous cases are even less.
Exactly. So our problems are many. We have late presentation. We have very few people trained to diagnose and treat cancer. We have few labs to do these diagnoses because you need special tests. You need a pathologist to be able to look at tissue samples, to be able to make a diagnosis, to be able to classify, to be able to treat. So it's not just one person. Even if you train somebody to treat just cancer, it's not a one-person job, it's a team job. You need support in terms of drugs, in terms of blood and blood products. So sometimes the children need to be in an ICU, which we don't have ready access to. So to be able to get a good outcome, we have a long way to go. And that's why we are trying to embark on this advocacy thing, to try to at least catch the children early or make the diagnosis earlier, and so that treatment success rates are higher, and then it's more encouraging. If you have all your children coming in and out of 100, only 20 survive, they're not very encouraging statistics, and it's depressing for parents. And that's what keeps people away from hospitals, because when they hear that if you have cancer, you go to hospital, they give you chemotherapy, the child dies. Okay, but it shouldn't be like that. We should be able to support these children even when they are very ill on chemo. And those are all systems that we need to put in place. So I think it all starts with advocacy, raising awareness about the problem and trying to get people to focus on how we can make things better, because cancer affects children across the society, rich, poor, middle income, everybody. But if you're poor and your child has cancer, the impact is higher because parents are unable to afford investigations, are able to afford medications, and that's why there needs to be a broader social support for this program.
And if we want a broader social support, where do we start from?
Well, we can advocate for NHIS, for example, to be able to take up some of the cost. Because as it is now, if you came in once the diagnosis is made, that's it. It means NHIS doesn't cover anything you come in with. But if they could, even if it's not a full, because the drugs are expensive, it might be difficult to take it up, but at least a partial, like a cost-sharing thing, would be beneficial. We would also need individuals, NGOs, societies to come in and help. We have a number of societies who come in and actually donate money for the care of these children, and so we have a fund into which people come and contribute, or you can actually adopt a child depending on what you want to do and see the child through treatment. So we have various modalities on the ground through which people can come in as individuals or as societies to help these children and these families, because it is very distressing. And sometimes the treatment for leukemias, for example, is quite long, 2 to 3 years. And so you realize that at least one parent ends up not working for a while. The child is out of school for a while. So the implications on the family are quite severe, and they need that support from the broader society.
The association, how do you make sure that, well, the advocacy that you have commenced, you are able to consolidate and sustain?
Well, it's we belong to a group. We are members of ICIPO, that's International Confederation of Childhood Cancer Parents Organization, which is also affiliated to SIOP, which is International Society of Pediatric Oncology. And because we are members, we have a focus as to what we are doing, and regularly we visit the hospitals, we visit the parents, we talk to them, we try to encourage them, we give them support in various ways, and mostly at the psychosocial level. I mean, trying to tell them what to do and what not to do. You know, when you have a parent in that situation, the person cannot think straight. And therefore you need support. You need support. And that is what we do.
Very often when you go to the hospital, they would have to undertake a number of tests. And sometimes, most often, the tests are not undertaken. The doctor will do some minimal examinations and say, well, you have malaria, etc. So before they do the critical test, the cases might have advanced. As a practitioner, are you worried about it? And how do you make sure there's a link between what is present day needs that need to be undertaken at the hospital when somebody is there for treatment, and then what needs to be done appropriately?
Well, it all comes into training, isn't it? So the more trained health workers, health personnel you have, it will surprise you to know that in lots of places, it might not even be a medical doctor. It's probably a medical assistant who is a nurse who is trained to treat certain things. So they might not be as aware of certain conditions, or even with a doctor, a general practitioner may not be as aware of certain things as you who has been trained to do it. So training across board is important. And that's also part of the reason why we're doing this sensitization. It's for parents and caregivers, but also to alert healthcare workers to this risk in the background, so that if you had certain signs, it sort of rings some alarm signals. And so if you just allow me a few minutes, I could go through those signs. Okay, so for us here in Ghana, we have this poster. I don't know if we can see it properly. So it has some of the early warning signs of the commonest cancers we see. The commonest ones we see are the lymphomas, and the commonest is the Burkitt's. Commonest site is the jaw. Okay, so they have jaw swellings, and then there's their teeth get displaced, some fall out. And this grows quite quickly. So in a few months, there's a very huge swelling. So when there's a swelling, you can imagine initially you might think there's a tooth problem, then a jaw problem, and all sorts of things will be smeared on. By the time the child comes, it's really huge. Then you have the lumps in the neck, which are also can be with lymphomas or with leukemias or other tumors. But essentially, if you have lumps anywhere where lumps shouldn't be, we really do not have lumps around. So if you can feel a lump anywhere, on the jaw, on the neck, in the abdomen, those are the common size, or on the limbs, that is increasing in size. I mean, these lumps in the neck, if you have a sore throat or an infection, sometimes you feel some small lumps in your neck. But if they are continuing to grow, or they grow big and they are not going back, and it's a concern, I see you're feeling your neck already. Everybody has them. They're small. They're lymph nodes. They help you. They're important in your body's defense mechanisms, but they shouldn't be sticking out like that. And then the third commonest one is the eye cancers for us in pediatrics. And the first sign usually is when you look in the black center of the eye, instead of seeing a red, you know, sometimes when you take a picture, there's a cat eye that's red. That's good. That's a good sign, actually. So if it's white in there, it could be a sign of a cancer of the eye. It could also be a cataract. So it's not like once you have a lump, it's a cancer. There are different things that can cause it. But then that's when you need to be screened appropriately, referred to the appropriate place for further investigations. We don't want to see when the eye is protruding and it's so bad. We have a few other pictures but that's unfortunately how most of them come in, by which time nothing much can be done.
And means that they've advanced?
Yes, exactly. So those for us in our local incidences, because in the developed world, the commonest is a leukemia, and that is usually of the blood, and so the children end up being pale, like their blood levels go down. They may have bone or joint pains, but for us, and that's the second commonest for us. The commonest for us is these lumps, then the leukemias, and then the eye. So a white spot in the eye or a bulging eyeball, an unusual lump or swelling anywhere else, especially in the jaw, the neck, or the stomach. Fever for more than 2 weeks. I mean, we'll treat for malaria, we'll treat for all sorts of things. But if a child has a high temperature that is not going down, then we need to look further into that fever. Unexplained weight loss. And then the bleeding, because when your bone marrow or your blood is affected, it affects all the lines that come from there. So the child is pale, may bleed easily as well, may get all sorts of infections that cause a fever. So bleeding, unusual bleeding, is also something that should be looked at. Like I said, persistent joint or bone pain. Might be other things, infection, sickle cell, anything else. But once we have not been able to explain that, then the child needs to be referred to the appropriate quarters for appropriate investigations. And you can also have tumors or cancers in the head, in the spine, anywhere else. So persistent headaches, especially if it's associated with vomiting in the mornings, or suddenly the child's walk or gait changes, suddenly is not able to balance properly or has a weakness somewhere, doesn't always mean a cancer, but that's a sign that we need to look out for. So for us locally, this is the poster we have come up with. In other places, they use what they call the Siloam sign. The signs are basically simple, but just named after a Russian
Now this
monk.
one is made for our environment.
This is made for our environment. Okay. So it's basically very similar. So each area has a way of putting it so that their people can appreciate it better, also depending on the commonest signs you have. So we have these posters. Sometimes we go around churches, talk to them, leave posters behind. Groups that are interested, we go and talk to them. And so it's important that we raise awareness. And like you said, even for healthcare workers, if we could do for the eye cancers, one of the things that you can do, because sometimes it's difficult to see just looking that it's white, but we do what we call the red reflex, with a shine a certain light, and we should be able to see that red light coming back out. So if we could even train the nurses at weighing clinics to be able to just do that, that's a good time to screen these children for these eye cancers, which are very common, relatively common in our parts.
Okay, so they affect all categories of children.
All categories of children. No
okay, so our last word before you go. Where are you taking the train next? You just continue the advocacy?
Yes, but our number one priority now is to get a hostel, you know, for about a 30 or 28.
You mean a boarding place sort of?
Yes, for parents.
Or a
because they come from all over the
over.
country, and
where
to stay is a problem. Yes, in Korle Bu.
Okay.
Korle Bu
Korle Bu has given us land for the hostel. We are now trying to raise funds to build that hostel.
That'll be easy. With the two of you, I'm sure you can do that.
And with your help.
Oh, yeah. Yes, the media is always there to assist.
Yes.
Okay, so we'll see how that goes. And anyhow they can reach whoever will be interested would want to.
We're going to have a launch pretty soon, yes.
Okay.
And where we would invite you and all concerned.
You mean you invite the media?
We invite the media and we invite Ghanaians who would be prepared to, you know, contribute to this cause, this worthy cause.
And the Parents Association also have a website.
They do?
So that's a place.
The website is on the, what I've just given you. This one.
And so the website, they have a website. Please visit there and let's get to hear from you. We have www.ghapaccp. Okay, so it's again www.ghapaccc.com. And that is the website. Please get there, get a lot more information about the Ghana Parents Association for Childhood Cancers. You get to know a lot more about the subject of childhood cancers, how they affect children, what signs you should be looking out for, and why you need to get early treatment for early detection, because that is critical for making sure in the course of the treatment period that is done right, appropriately, as seen in the medical books. We have had in the studio Dr. Charlene Kilban. Did I pronounce Kilban? Kilba. And she is a pediatrician with the Korle Bu Teaching Hospital, and also with the Ghana Association of Childhood Cancers, Ghana Parents Association of Childhood Cancers. The president in the studio, Dr. Felix Kwame-Ave. Thanks. He's also a lecturer, though. I needed to ask that one. I added that one. And thanks for passing through. Thanks also for watching the show. We know